If you live in Taiwan and have ever made use of its healthcare system, you'd know that it's top-notch. Most day-to-day healthcare needs, from cold medicine to minor surgeries, are paid for by the universal healthcare system. Rain or shine, or even on statutory holidays, you can even find a clinic open somewhere near you. Worst comes to worst, you can visit a local hospital's emergency room and see a physician within half an hour. However, a recent survey from Newsweek and Statista, looking at 250 of the world's best hospitals, only placed one of Taiwan's hospitals on that list. Today, we will answer the question, is Taiwan's healthcare system as good as they say? And how can the NHI be further improved to truly make Taiwan's healthcare deserving of the praises it gets from the international community? I'm your host, Joey Chou, and this is Beyond the Reefs. Hi, you're listening to Beyond the Reefs, a show produced by Radio Taiwan International. Here we talk about socio-economic issues that are faced by Taiwan and their broader impact around the world, beyond the reefs of this island nation. When we think of universal healthcare, we usually think of the Scandinavian countries of Denmark, Norway, and Sweden, where their healthcare systems are mainly tax-funded, characterized by high-quality care and efficiency. The United Kingdom and Canada might also come to mind, but these are also some of the countries that have the highest tax rates in the world. High earners can pay more than 50% of their annual income to the government in taxes. And I know that in the case of Canada, because I have family there, that the country is in a healthcare crisis, with only 20 physicians to every 10,000 residents. Anecdotal accounts reveal that our average wait time for cancer treatment is about 27 weeks. That's 7 months. Imagine you have stage 4 cancer and you have to wait 7 months from your physician to a referral and then to eventually receiving treatment. So, coverage for healthcare expenses alone isn't enough. Good healthcare needs to be readily available when needed. In comparison, Taiwan's healthcare system seems to be better in that regards. The tax rates are not too high, the insurance premium is very affordable for the individuals, and most importantly, there are more clinics than convenience stores in the country. Which is no wonder why a survey from Numbeo, an online database that looked at 94 countries around the world to come up with the ranking based on their healthcare indices, Taiwan has ranked number 1 for 6 consecutive years, beating Japan, South Korea, and every other country I mentioned above. However, if Taiwan's healthcare system truly were that exceptional, why did only one hospital out of nearly 500 around the country end up on Newsweek and Statista's World's Best Hospital list?
The island of Taiwan has created a model of universal healthcare that promotes health equity. From primary care clinics to leading medical centers, medical service providers must adapt to the changing environment to safeguard the health of their communities.
Now we have a game changer.
Taiwan's struggle and success may shed light on the issues challenging healthcare systems worldwide. By the early 1990s, more than 40% of the population in Taiwan did not have medical insurance, as the existing medical insurance schemes were heavily subsidized by the government and saddled with debt. Taiwan's Ministry of Health assembled a committee to draft a master plan and conduct the actuarial calculations. The universal coverage model, funded primarily by payroll-based premiums, triggered social tensions. The success allowed the NHI administration to consolidate existing medical services, distribute resources, and launch other healthcare schemes, including the integrated delivery system.
Taiwan has what is considered one of the world's best healthcare insurance programs, a single-payer system run by the government. Patients pay a premium benchmarked to their income and co-payments to a GP cost of around $2.50. But this low-cost approach is cracking. Declining birth rates and an aging population are adding more pressure to the system. Vice journeys inside one of the world's best healthcare systems to find out why it's cracking.
Taiwan's medical doctor per capita number at approximately 20 to every 10,000 people is relatively sparse compared to other countries such as Sweden and Norway, which are at 71 and 51 doctors to every 10,000 people, respectively. However, the average Taiwanese uses medical services 16 times every year. For comparison's sake, the average Swede, Dane, and Norwegians visit doctors 2.3, 3.8, and 3.9 times, respectively. It's an understatement to say that the Taiwanese people rely a little too much on the affordable healthcare system. The NHI system is a compulsory social insurance. Every Taiwanese citizen with household registration or foreign nationals living in Taiwan with an Alien Residence Certificate, ARC, or APRC, regardless of age, gender, or employment status, must enroll in the program. It is paid for by three parties: the individual, the employer, and the government. For an average working class, 30% of his or her NHI premiums is automatically deducted from the individual's monthly salary. It's not much. An average earner pays around 1,000 to 2,000 NT dollars. That's about 30 to 60 US dollars. The employer picks up 60% of the tab, while the government subsidizes the remaining 10%. Premiums for dependents are added to that of their working spouse or family members at a discount. That's a very generalized breakdown for the majority of the people living in Taiwan. As you can see, this means that a large portion of Taiwan's national health insurance is supported by the working class and their employers. But as we previously mentioned, like many developed countries around the world, Taiwan is soon to become a super-aged society. The growing number of seniors not only adds to the demand for medical resources, but there is a shrinking workforce to pay the premiums that support the NHI program. How will Taiwan continue to support its healthcare system? Today, we'll be speaking with Julia Bergstrom, senior editor of AmCham Business Topics magazine, whose home country, Sweden, is actually ranked in the top one-third on that Numbeo healthcare indices by country survey we talked about.
I'm Julia Bergstrom. I'm the senior editor at Taiwan Business Topics, a monthly publication by AmCham Taiwan. I've been in Taiwan for almost 5 years. I'm just a few months shy of my permanent residency. I'm from Sweden, and there are a lot of differences in the healthcare systems between Taiwan and Sweden. Sweden has universal healthcare coverage. Taiwan also has it through the national health insurance, but Taiwan's healthcare is much more accessible. You get to a doctor faster, you get an appointment quicker, there are more hospitals to go to, so it's definitely fast. And even if you don't have health insurance, it's cheap. My first year here, I was a student and I cut my finger, so I went to the ER. And, it took less than an hour. They fixed me up. They gave me the shots you need when you cut yourself. And it cost, I think, less than 1,000 NTD, even without health insurance. That's incredible. In Sweden, I would have had to wait for probably 8 hours at the ER because the queue to the ER is so long. But there are also differences between Sweden's and Taiwan's healthcare system where I think Sweden is stronger. So one example is the lack of personal healthcare. In Sweden, we have a house doctor. So you have one doctor that you've been going to for several years. They know your history, they know who you are, and they know your issues. And so they can provide a different type of care compared with someone who is just meeting you for 2 minutes and for the first time. So that's where I think Sweden is stronger. And a tendency in Taiwan is also to overprescribe pills and medicines. And that includes, antibiotics is definitely one. But just go in with cold symptoms or feeling generally unwell. I've been prescribed codeine and morphines and antibiotics for things that really didn't need them. I had one friend who was prescribed Xanax for a cold. And even one friend that got OxyContin. There is a tendency to overprescribe. So in our membership, we have a lot of pharmaceutical, public health, and medical devices company. So we care deeply about healthcare. And this article came from an event that we had about investing in health, inviting industry and government and academia. So we talked about there are a lot of challenges that Taiwan's healthcare system is facing, as is, I think, every healthcare system in the world is facing some type of challenges. One of these is the healthcare outcomes when you compare them to neighboring countries. So Taiwan usually says the satisfaction rate is high for the NHI, but that's because the people polled, most of them are healthy. But when you look at the actual health outcomes, how long do people live? What are the cancer survival rates? Those are poorer than Japan or Korea. And that has also to do with Taiwan's healthcare expenditure. The OECD average is to spend about 8% of your GDP on healthcare. Taiwan spends a bit over 6%. And the increase in healthcare expenditure has also fallen behind Korea or Japan by quite a lot. So of course, with a smaller budget and less expenditure, you have fewer innovative medicines and treatments and fewer doctors that can care for people. Another thing that companies are advocating for is to accelerate the access of innovative medicines and treatments. So when a new drug comes on the market, it takes a long time for it to reach Taiwanese patients because the approval process is quite long and you need comparable drugs on the market. And so by kind of accelerating this process, newer, better treatments would reach patients faster. Another challenge for Taiwan's healthcare system is that the premium comes from the working population. A lot of the NHI budget and the healthcare budget comes from health insurances paid by employers, but the population is shrinking, especially the working population is shrinking. And so there are fewer people who are paying into the premiums. That creates budgetary issues and challenges.
On top of funding issues, there is also a policy issue. Taiwan currently contributes only about 6% of its GDP to healthcare, falling far below the OECD average of 9.2%. For more perspective, our Asian OECD neighbors, Japan and South Korea, are at 8% and 11%, respectively. In the American Chamber of Commerce's annual Business Climate Survey, which our guest Julia is the senior editor, we found that healthcare is consistently one of the aspects that makes Taiwan a good place for foreign professionals to live and work. But for a country that doesn't contribute as much of its GDP to healthcare, how do we consistently convince the international community that we provide good healthcare? Well, first of all, it's no secret that Taiwan's doctors and nurses are overworked and underpaid. So it feels like you're always able to get healthcare services right away while paying very little for it. Last year, Taiwan's healthcare workers held month-long protests to highlight their excessive work hours while being underpaid. And it's not unwarranted. Compared to, for example, South Korea, our healthcare professionals get paid about half as much on average. I have personally seen doctors start their days as early as 6 a.m. to get prepped for surgery, make their rounds for their inpatients by noon, and then go straight to the outpatient department and consult more than 100 people until dinner time. Yes, they're one of the highest paid professionals, but do we really want our physicians, especially the surgeons who literally handle matters of life and death, to be overworked and exhausted? So far today, we've discovered that there are quite a few screws loose in Taiwan's healthcare system. How is the government dealing with these issues?
What we've been talking about as well is digital health and kind of doing home treatments, a lot on preventive care, because Taiwan's doctors are quite overworked and they have a lot of patients to see in a day, right? They maybe have 2 minutes with a patient. They go, hey, what's your problem? This and that. And then they leave. So they don't have time often to do these very simple interventions, like let me listen to your heart for 30 seconds, because they don't have 30 seconds. So for example, osteoporosis is a huge one. So basically weak bones, right? Where if you have osteoporosis and you fall and break your hip, your risk of dying within the next 4 years dramatically increases. There are some programs from the government on sending out vans to rural areas to do screenings and to encourage people to screen for osteoporosis, as well as, breast cancer. Those are the very famous ones, right? The breast cancer buses that go around the country. That's a very important effort that the government is doing, but it's also about educating people and motivating people to actually perform those screenings. If you are at the age where you're supposed to test or screen for something, please do it. Another fun one that we covered briefly was about heart murmurs. When people think about heart diseases, they think about like heart attacks or clogged arteries or the big ones. But there are heart valve issues as well, are a huge part of heart health, and it affects a big part of the population. So there was one company that worked together with hospitals around Taiwan to do an event where they encourage people to go listen to their hearts. It's a 30-second thing. You listen with the stethoscope on your heart to find the murmurs. So it's about having international collaboration. So Taiwan and the US, they are strong partners in healthcare. And then it's also about public-private partnerships and collaborations, right? Working with industry and industry working with government. Taiwan and the US has signed a memorandum of understanding, or an MOU, on healthcare to kind of build a foundation for more cooperation. So this MOU includes programs, personnel exchanges, trainings, workshops, and conferences to promote bilateral cooperation in global health security, chronic disease prevention, digital health, and general health capabilities. And both countries also recognize the need for more strategic investments to handle, the challenges of a super age society, because with that comes rising chronic diseases. The US supports Taiwan's ambitions to reach the OECD average of healthcare expenditure, and also to work with innovation in pharmaceuticals. There are some collaborations in how to streamline processes for licensing and reimbursement within the Taiwan National Health Insurance Program. Another big thing is preventive care. So vaccinations, screenings, awareness, shifting the mindset from seeing preventive health in particular, but healthcare in general, as a burden on the economy and more as an investment. If we invest early, if we get everyone vaccinated against HPV and hepatitis, and if we screen for osteoporosis, is a huge one, basically weak bones, then we will save money compared to treating those issues, discovering cancer at stage 4 rather than stage 1. It's going to be more expensive. Another thing is mental health. And so the US and Taiwan are collaborating on providing early intervention services, also some mental health challenges that can be treated with long-lasting injections. Rather than having to take your pills every day, you go twice a year to the doctors. Those kind of collaborations are also happening.
Those are only some of the solutions that Taiwan's government is looking into to improve Taiwan's healthcare system. I like to quote from Benjamin Franklin, who said that in this world, nothing can be said to be certain except for death and taxes. Perhaps that's a grim look in the social contract we sign with the government. If we instead strive for health and taxes, where our country is willing to allocate a larger percentage of its GDP to invest in healthcare and make policy changes to take care of our health professionals, I'm sure people would be much more willing to pay the taxes. Finally, remember that at the start of this episode, I mentioned a recent survey from Newsweek and Statista looking at 250 of the world's best hospitals, and one of them is in Taiwan. That's Taipei Veterans General Hospital, where my father received his lung and kidney cancer treatment 5 years ago, and he's still with us, alive and kicking. So keep that in mind if you ever need top-notch medical help. Coming up next week, we're going to look at a common thread in the last couple of episodes, an undercurrent that affects most, if not all, of Taiwan's recent socioeconomic issues. That is the phenomenon of low birth rates, and we're going to try to discover how it's happening. I'm Joey Chou, and you've been listening to Beyond the Reefs.